We have online the Chief Medical Officer, Dr. Jacqueline Besesa McKenzie, and we'll be speaking about what is happening now with the appointments for the second dose vaccination. Good morning, Dr. Besesa McKenzie. How are you?
Hi, good morning, and good morning to your listeners.
Yes, awesome to have you here, and great news that we have enough vaccines in the gift from Mexico so we can continue the process.
Right, so just want to reassure Jamaicans that we have enough vaccines to vaccinate all persons that are due their second doses. And so we have an appointment system in place, and we want persons to adhere to the appointment system in order to keep the order. There's no need to rush, no need to go to anywhere and sit down from 4 o'clock or 5 o'clock in the morning. Right. Just go online, make your appointment at www.moh.gov.jm, and the appointment system is working. It worked well yesterday. This morning I understand there were a few glitches, but that has been sorted out now. The persons are able to go online and make their appointment.
They can also call, right?
Right. They can also call the 888-1-LOVE number if they're not able to use the web-based facility.
Okay. Now, I went online yesterday and I want to confirm that it is, as Dr. Besesa McKenzie is saying, it really is a simple process. I do understand that not everybody is tech savvy, or, understanding how to use computers and so forth. So there's an option to make the phone call and get the information as well. But as you heard, you can call, you can go online or you can call. Now, Doc, what is to be expected if you can walk someone through the process?
Okay, well, once you have made your appointment, then you need to show up at the site, and you will need to have with you your vaccination card as well as a government-issued ID. Some persons would have used a JP-issued letter to get their first dose, and they can carry that letter again to get their second dose. You get there at the appointment time because, as I said, you don't need to try to come early to get through early, because that's only going to cause crowding. And we know that, there is going to be some crowding, but we want to decrease it as much as possible to make persons comfortable. Once you get there, you will be registered. Your information is going to be entered into a computerized-based system, so that we're able to track the numbers. And once you are registered, then you will receive the information, health education messages again about the possible side effects of the vaccine, what to expect when you go home, how to manage that, and to report any adverse events online, etc. And then once that is done, then you will go in to get your vaccine. We have different arrangements at different sites. Many persons are familiar with the national arena situation, where it is that you will go in and you persons will come to you to get the vaccine. Right. You wait for half an hour, during which you are there for us to see if you develop any problems right away that needs any kind of intervention. And after that uneventful period, then you are given your card, with now updated with your second dose and stamped with the government approved stamp, and then you'll be able to go home.
Okay. And I was just reading something in the Healthy Way. I was told take Panadol before you go. But then I was reading something that says don't take anything before. Well, I don't know if they meant Panadol, but is it advisable to have 2 Panadols before you go?
Well, most people will have no symptoms at all. Some people not even a little pain at the site.
Right.
And so therefore, it's kind of, not necessary to take Panadol. And usually the effects that you get if you do have mild pain at the site, those will tend to come on a little bit after.
Okay.
And so if you take Panadol before, then certainly it will decrease that discomfort. But it is not necessary for everybody to take it. We can't predict who is going to have problems.
Right. Okay.
But the symptoms are mild, and usually if you start having the symptoms, you can take the Panadol. But if you are of the mind that, I want to make sure that nothing goes wrong, so I want to take it before, then there's nothing wrong with that either.
All right. And then, of course, after you get the second dose, it's how many weeks after that the person is fully, the process is complete?
Right. So 2 weeks is what the scientific evidence is saying, that 2 weeks after you have received your second dose, you would be fully immunized with the highest chance of having good antibody response and being able to fight off the COVID-19 virus. Remember, though, that even after vaccinations, there are some people who will get COVID still, but because of the antibodies on board, it will be a much milder illness.
Okay.
So there is definitely 98 to 100% effect in most studies that have said that no hospitalizations or severe illnesses after, and that is severe COVID-19 illness after taking the vaccine. So there are some people who will still get mild COVID. There is the word is still, it is still being debated with how much of a transmission risk there is with that mild COVID, and so therefore we do encourage persons to continue with their precautions,
Right.
especially when they're among unvaccinated persons and vulnerable persons, who may be at risk for a severe illness if exposed.
Right. My parents went through both the first and second dose, and praise the Lord, they're fine. I mean, I doubt if I saw them with a headache. I doubt I saw them with a headache. They were, quite fine. I had my first dose. I had a little swelling one place, and 2 tools, it was gone. But then there was somebody else who I knew who went the same day I went, and they had, some discomfort, but they're fine now. So as you are saying, it does vary. The side effects will vary from person to person. Don't be anxious and exacerbate what is going on, make it worse, both in your mind and in reality. Anything else you want to say to just let
Right. I just want to latch on to that point when you say that your parents have gotten it, and you appear to feel so comfortable just knowing that they're protected against COVID-19. And I just want to encourage, a lot of younger people are deterring the older persons from getting vaccinated, and I really just want to encourage them, because older persons are at more of a risk of severe illness, and so encourage them to go out and get their second doses. Persons need to just ensure that their elderly neighbors, relatives reach out to them to say, do you have a right to go and get your second dose? Have you made your appointment? Can I help you to make your appointment? But it is in everybody's interest to get those persons to have their second doses, because, with the restrictions that are opening up, we do encourage persons to exercise caution You have an option now, but, Jamaicans have done very well, even though, a lot of people are saying people are not obeying restrictions, people are not obeying quarantine. The fact is that our numbers are down, and it's a reflection on the fact that a lot of persons in the population have been responsible. Now that they have an option, they must continue to be responsible. Right. Because now you have the freedom of choice. Let it not be a freedom of choice that say that we choose to have a surge. Let it be a freedom of choice to say that we choose to keep our numbers down, and we choose to keep our vulnerable persons protected by ensuring that they are vaccinated.
Okay. All right. 2 questions just came in. One person says, I got my first dose on June 20. Can I get my second dose now? But I think that's too early, right?
It's too early. The studies have shown that you have a more robust immunity with the second dose being spaced at about 12 weeks.
Okay.
So it is too early. And remember now that we have enough doses to provide the second dose for those persons who are due. But we do have persons that are due at the end of July and in August.
Right.
And we anticipate to get more AstraZeneca doses to be able to vaccinate those persons. But right now, the persons that are due the vaccination are of utmost priority to get their vaccines. Other persons who their dates are not due yet, they should wait until that time to get their second dose, because they have a better immune response with the second dose being at about 12 weeks.
Okay, is it 8 to 12 weeks, or is it 12 weeks?
It's 8 to 12 weeks. The recommendation says 8 to 12 weeks, but the studies have shown that 90 days, if you get your second dose at about 90 days, the actual immune response is better.
Okay. Okay, and I see another person saying, what about young people that need their first dose?
Okay, so right now we have the AstraZeneca vaccine, and we need to get the second doses.
Right.
You know that there are a lot more vaccines that have been approved now, and we cannot guarantee which of the vaccines we're going to get moving forward. So we really need to ensure that the AstraZeneca is used for the second doses.
Right.
After we have completed the second doses, and which would be in July, August, if we have any leftover AstraZeneca, we would ensure that we have enough for first and second doses before we give first doses of AstraZeneca.
Right.
We are anticipating to get more vaccines this month in order to start again the first doses. So I can't say for sure which vaccine it is, but the indication is that it's not going to be AstraZeneca, that we're going to be getting in the next allocation. And so therefore persons have to be prepared to receive that. And we will let you know when, but we do anticipate that the first doses we will start again sometime in this month, in July.
Okay. How long after you have received the second dose can one travel? Is there a limitation now that you can only travel if you have both shots, or what's the situation there?
Well, I mean, different countries, we don't have any exit requirements for travelers.
So persons can travel now with one or without any, but have
right, as long as it is that they obey the rules of the country to which they are going. Right. It is difficult now to have vaccination as a general travel requirement, because the situation in countries vary so much. There are some countries that have a high level of vaccination, and there are some countries that have very, very small levels of vaccination. So it is hard to impose vaccination requirements on general traveling because traveling is for various reasons.
Right.
One is that persons may put in vaccination requirements for certain types of travelers that are optional traveling. And some countries have done that. But generally speaking, you really just need to see where you're going to, what are the requirements, and ensure that you meet those requirements so that you don't end up being stranded when you get to an airport, and not being able to carry out your plan.
Okay. Well, I think we have covered all the questions that were coming in. Some of them were repeat questions. Anything else that you would like to mention, Dr. Bisesa McKenzie?
Right. Well, I would just, as I've said before, just to encourage persons to come out and get their second doses. When we start the first doses, again, to encourage especially the vulnerable persons to come out and get the first doses at that time. Right now, please bear in mind, no first doses at this time. No first doses. And so therefore, persons just need to make the appointment for the second doses. They need to keep the appointments. Please adhere to the appointment schedule.
Yes.
Let us not have any chaos. Don't come at 4 o'clock and sit down and wait. And then by 9 o'clock, you're frustrating yourself and you're frustrating everybody around you.
Yes.
Just stick to the schedule, stick to the appointment system, and we'll get it done.
Indeed. I'm so sorry. 2 more. And the reason is because of the types of questions. One person says, I visited abroad for the summer, took my first job, I suppose before. Could they get their second job when they return to Jamaica?
And this is the first vaccine was the AstraZeneca vaccine.
Right. So if you're listening, I don't see your name. If it was the AstraZeneca that you got, I hope you're still listening. You need to respond. So if it was the first, if the first job was the AstraZeneca, and the 12-week or 8 to 12, they're in the 8 to 12-week period, then they can get the second, is what I'm hearing, right?
Right. Well, we're not going to turn our back on our Jamaican people, and our aim is to try to get persons vaccinated.
Right.
So I would suggest to that person that they ensure that they have their documentation of their first vaccine, and they contact the health department, the relevant health department, and just speak to one of our medical officers of health. It is our intention to get everybody vaccinated. We're not going to turn our backs on anybody, and so therefore wherever we can facilitate. But you do also understand that we do have to plan. And so if we have a mass of persons that are coming in with a first dose from elsewhere, requiring a second dose here, it will hamper our planning.
That's true.
But we certainly want to facilitate as much as we can everyone to ensure that we get our population vaccinated.
Okay. Marlene says, what if you caught COVID? How long after you're okay from the COVID can you get the vaccination? So what if somebody got COVID?
Right. So for persons who have had COVID, the evidence that is out there now is saying that these persons will have probably about 6 months of natural immunity, after which their antibody levels start to decrease. So therefore, persons have that option to wait until 6 months. I would not encourage anybody to wait exactly until 6 months, because I am not sure what is the level of immunity that you would have had. I don't know.
Individual case.
In each individual case, because we know that persons with mild illness may not have the exact same robust response or antibody production as somebody who would have had a severe illness. And then we also can contemplate that different age groups may have different levels of response. Persons with some sicknesses may not have as robust as a response. So I wouldn't say to anybody, wait 6 months to get your second dose. I think as soon as you can get your second dose, you should. And in terms of that, what we're saying is that once your symptoms have cleared and you have completed your 14 days isolation period, you have been asymptomatic for at least 3 days, then you can get your second dose of vaccine.
Okay. Should persons ostracize persons who have been diagnosed with COVID? Should persons be afraid to go around them? Because I've seen that. And when I say afraid, meaning that they're concerned that they could catch it from them. If somebody has COVID, they have overcome it, gone through the whole, gone to hospital, taken the medication, they're fine, the doctor has cleared them, they've done the test, they're not COVID positive anymore. Should someone else be afraid or concerned that they could catch COVID from that person?
Okay, first of all, I want to remind everybody that you can catch COVID a second time. We have had a few persons that we've had a second episode of COVID-19, and we're not sure if it is because of it's a new variant. Right. So those persons are still at risk. Right. But so they should continue to use
wear
their
the
precautions.
mask.
Right. The same precautions will still be in place. However, for the persons who have had COVID and they are now symptom-free, they have completed their 14 days, there is no increased risk of catching COVID by being around them. Okay. So persons should not stigmatize those persons or ostracize them, or they need to stay in one room all the time. Mm-hmm. Those persons are the better persons probably to be around because they have some immunity. Mm-hmm. And unless they catch COVID again, you're very unlikely to catch COVID from them. Right. Unless they have been exposed and is transmitting it.
So it's almost like they've gone back to square one, but maybe not square one, maybe square two.
Right. They're never been to a better place than square one. But the same precautions, that you would use in interacting with just anybody, if you continue to use those to protect yourself and to protect the persons that you may come in contact with.
All right. Repeat the measures to take if they are experiencing COVID symptoms. What does someone do? Boy, this interview long, but it's so informative, and I love sharing information. What does someone do if they are experiencing COVID symptoms?
Okay, so if you are experiencing COVID symptoms, the first thing you need to do is, if it is a mild symptom, meaning that probably you have a slight cough, or it is that you have a slight temperature, or you just generally not feeling well, maybe a little runny nose, some sore throat, maybe you're just having a loss of smell, loss of taste. But if there are mild symptoms, then you can stay at home and take symptomatic relief, such as your Panadol, some antihistamines, rest, drink a lot of fluid, make sure that you're trying to eat something to keep your strength up, make sure you keep hydrated, and the symptoms will settle down within a few days. If it is that your symptoms are getting worse and you are not feeling better, then it is that you need to seek medical advice. You need to go to your doctor, call the doctor first, call the doctor's office first, and tell them that I have these symptoms, I think that I may have COVID, so that they can advise you and to advise the office staff of what precautions you need to take in order to come to be seen. Right. Or if it is that you are going to the health center or to the... Right. You usually you don't have much of an opportunity to call the health center first. But when you go into the health center, you need to speak to the customer service person or the triage person and let them know that these are the symptoms I'm having, so that you can be separated as soon as possible from the rest of the persons that are visiting the health center. So seek medical advice if your symptoms are persistent and if they are getting worse. At that time, you may be required to do a test. And if it is that you are required to do the test, then you should do the test, and there will be questions asked as to who it is that you have been in contact with, so that those persons can be contacted. The health department should be contacted if it is that there is a high suspicion of COVID, to advise them that you have this person. But the doctor that sees the person, whether it is in private practice or in the health center, can advise the person to isolate until their results are back. And once the results are back, that they have to be in isolation for 14 days. And a determination would be made whether or not that isolation can be done at home or needs to be done within a facility, because that's going to be based on your physical examination. And if there are any kind of warning signs that would suggest that you're at risk for a more severe illness or for deterioration, you would be advised to go to the hospital. But many persons can actually be treated at home because they have mild symptoms.
Right.
Yeah, so there's nothing wrong with that. Not everybody that needs to go into hospital. Hospitalization are for those people that have more severe symptoms, may need to be on oxygen, may need to get fluids, intravenous fluids, in order to get their vital signs up if they are deranged. And also persons who may have other illnesses that they would require monitoring in hospital. But even when you go to hospital, again, your assessment there, it would be a further assessment, and the emergency room doctor may, after examining you, doing more tests that would not have been available in your GP's office, may decide that we're satisfied and you can go home, or it is that we may need to observe you in hospital.
Right.
And even after they have admitted you to hospital, the specialist on the ward does a further assessment and may make a different determination. So it's a stepwise process, that first starts with the recognition that I have symptoms, I may have COVID. Let me first protect myself, protect others around me. Right. Take the necessary steps to improve my symptoms. If it is that I am not improving, seek medical advice. You may need to do a test, get that test done, and you have to give us the information as to who are the other persons that may be at risk around you.
Oh, I tell you, what about persons planning to start a family, planning to get pregnant, or, do they need to be concerned? Can they get the vaccine?
Well, yes, they can get the vaccine, and as a matter of fact, what we have seen is that COVID-19 illnesses in pregnant patients can have severe outcomes, and so therefore you would want to ensure that if you are at risk, and especially if you are in an occupation like a healthcare worker that puts you at more risk for exposure, then you would want to be vaccinated, because the benefits of the vaccination far outweighs the risk you have of getting any problems with the vaccine. So the risk of having a severe illness with COVID-19 is there. And also for persons who are breastfeeding, they can get the vaccine as well.
Okay.
It is not a live vaccine, so therefore no virus would be transmitted to the baby, so they can be reassured that they can continue to do breastfeeding, and they can get the vaccine.
Okay. Boy, I tell you, this for me, I'm so grateful for you taking the time, Dr. Bisesa McKenzie, to answer all these questions, persons writing in and asking questions, texting in, and so forth. I thank you so much. And of course, once again, today, now would be a good time to go on the site, the Ministry of Health and Wellness website. And if you need help, text me here at Love 101. I'll be happy to share the link with you so you can go on, and the number, if you're not online, there's a number you can call and make your appointment. Dr. Jacqueline Bisesa McKenzie, Chief Medical Officer, thank you so much. And have a wonderful rest of the day. I pray your strength. I know this can't be easy. It's a first in so many ways, but I do pray your strength, yours and the team and the minister's strength, and also wisdom, godly wisdom in all that you have to do. All the best.
Okay, man. All the best to you and your listeners.
Bye-bye.